Hello, I'm Matthew Taylor from the York Health Economics Consortium, and I'm going to be talking about the role of healthcare tariffs in cost-effectiveness decision-making. So, let's start off by thinking about local and national level decision-making. National level decision makers, such as NICE, base their decisions on economics amongst many other factors. Now, even when a national level decision-making body makes a positive decision about something, there might be significant barriers to uptake. Now, these might include things like the difference between cost effectiveness and affordability. Just because something is deemed to be cost effective, it doesn't necessarily mean that the money is available to be able to pay for that particular thing. Likewise, we often see discrepancies between the short-term costs that are needed to invest in a particular piece of healthcare technology versus the long-term savings that might accrue through its use. We certainly know that healthcare commissioners are under a lot of pressure to look after short-term budgets, and it might be that if the benefits aren't going to be accrued until 30 or 40 years into the future, then it puts them in a very difficult position to make that decision to invest. Likewise, we certainly know that lots of costs and benefits can fall into different sectors of their healthcare system. The group that are paying for a particular intervention might not necessarily be the group that are going to realise those benefits themselves. So again, that's potentially a barrier that is often seen in decision makers such as the NHS. So I'm going to talk a little bit about tariff models and how they work to illustrate a particular case. I'll be using a hypothetical example for that so we don't get bogged down into too much real world decision making here. But let's just assume that we're talking about two potential devices that might be used in the NHS. Now, device A costs £100, but when it's used, the patient will need to visit a specialist clinic, which we can assume here costs something like £200 per case. Now, device B is a bit more expensive than device A. It costs £250, but crucially, device B doesn't need any monitoring at all. We can further assume that when somebody uses a clinic, a tariff of £200 is paid to the provider. Now, that money might come from a commissioner and be paid to the provider. And it's very important that we realise that that isn't necessarily a cost to the NHS. It's simply money moving around within the NHS. It's moved from one sector, the commissioner's sector, to the provider's sector, but the NHS's overall funds have neither gone up nor down. That's what we call a transfer payment in economics. I'm also going to assume here that the costs to pay for the device are split equally between the provider and the commissioner, although that's not too important for this particular example. Now here, if we imagine all of the things are being equal, we assume the devices are equally effective and everything else that goes with that, we can assume that NICE would recommend device B. And that's simply because the net cost for device B of £250 is less than the net cost for device A, which would be £100 for the device and £200 for the clinic. Remember that the clinic cost is £200. We're not talking about the tariff there, we're talking about the cost to provide the clinic service. So clearly device A would cost £300 altogether, device B would cost £250, and that's why a decision-making body like NICE would recommend device B. But the provider experiences a very different cost impact here. The important thing to look at is that overall, if we had a throughput of 1,000 patients here, the clinic costs would cost £200,000 for the provider, but because they're receiving a tariff payment from the commissioner, that exactly offsets the cost of those clinics, and therefore overall, the net cost of using device A is quite a lot less than the net cost of using device B, and therefore the provider would be preferring to offer device A to their patients. Now that's contrasting with NICE's view. But the commissioner agrees with NICE. When we work through the figures here, we can see that the commissioner is paying £200,000 worth of tariffs if device A is preferred. And that means that their decision is much more aligned with NICE. We can see that if we move to device B, there would be an overall cost saving for the commissioner of £125,000. So the problem here is we've got a discrepancy between the provider and the commissioner, that we've got misaligned incentives in the system, and it becomes quite difficult when we leave decisions up to different sectors. So in this diagram we can see what would happen if the tariff were to be varied. Remember, in the base case the tariff was £200, but it's interesting to see what would happen if we were to increase the tariff payment. Let's start with the provider, the blue line. Here, a higher tariff would mean that they would prefer to stay with device A, since they'd recoup lots of money through the tariff scheme. By switching to device B, they'd be substantially worse off. But for the commissioner, the opposite would be true. A high tariff would increase their preference for device B, since device B would avoid the need to pay those high tariffs. It becomes very interesting when we look at the other extreme, very low tariffs. In this case, a very low tariff might mean that the commissioner is happy to stick with device A. This is because, although device A means that clinic visits are needed, the low tariff means this doesn't really affect the commissioner's budget, and they'll prefer the cheaper device. The provider, though, would see the opposite effect. The low tariff would mean that they would not be fully compensated for the clinic costs, and they might be incentivised to move away from device A, which requires more clinic monitoring. So what we see is that there's a small window of opportunity where both the provider and the commissioner are financially incentivised to switch to device B, which was NICE's preferred option. For tariffs above that window, the provider would be worse off, whilst for tariffs below that window, the commissioner would be worse off. But in this very small window of opportunity, we've got a tariff system that would incentivise both the provider and the commissioner to switch to device B, and we might see improved uptake of that technology. Finally, it's important to note that the optimal tariff might not necessarily reflect the true cost of the service. If you remember, the clinic cost was £200, but a tariff payment of £200 might lead to misaligned incentives, as we've already seen. In this case, a tariff of between £75 and £125 would be optimal when aligning the incentives for all parties. Now, this even works when we look at the difference between short-term investment and long-term savings. We might imagine a technology where there is a short-term increase in cost, some kind of investment would be required, but after 5 years or so, and certainly in the longer term up to 20 years, we might see an overall cost saving. Now, we might have a decision maker that's focused on quite short-term cost impacts. They might be looking at the results after, say, 2 years. They would look at this graph and see that after 2 years there would be a net cost increase of €10,000, and therefore they might feel that it was not worth investing in this technology and we wouldn't see the uptake of it, even though in the long term we would be likely to see some cost savings. Now, because the long-term savings are more than €10,000, there could be a net cost saving to society, and that incentive would have worked and helped us to promote the uptake of a cost-effective technology. So in summary, we can see that when a national level decision is positive, it's very important for us to promote that uptake. We know that many barriers exist to reduce or sometimes delay that uptake, and the big problem here is that misaligned incentives can cause an overall harm to the health system and to the patients within it. Economic models can be used to help us understand these barriers and help us overcome them by providing the right types of incentives, and this is all done in a very transparent way. So if you've got any questions about the tariff systems or any of our other webinars, please do feel free to get in touch. You can see our contact details here on the screen, and thanks very much for listening. Thank you.